So yeah, really two questions. Kim, do you want to talk about the genetic codes versus FSHD part?
Yeah, so as we talked about before, pure coats, I really don't feel has a somatic genetic mutation, meaning it's not in every chromosome. I do think, and we're a long way off from being able to do this. There are techniques we could identify this, and we probably will be able to get there down the road. There may be focal genetic mutations within the affected eye, which is very different than having it, in the chromosomes. It's not going to get passed on. So I do think that these are different entities. And that being said, those are going to have different implications for genetic intervention. And that I think is the most simple way to think of the difference between the two.
Yeah, I think this question kind of also addresses a fork in the road in terms of disease therapeutics for many of the pediatric conditions that we are interested in. And that is, if there's a genetic abnormality, the children are likely best served if the therapy is available for that therapy to be applied at a point where many of the consequences of the disease can be prevented, right? So that means really early application of a therapy, and we don't have those therapies currently, right? But that's kind of one aspect of things, is preventing someone from having all the features of Norrie disease, all the features of FSHD, all the features of fever and the like. And even preventive therapies for ROP, for example, that are currently not genetic therapies, but identify them early and treat them with laser or drug therapy in a timely fashion. Then another common question is, I think what the second half of the question addresses, and that is, okay, so let's say that your child ends up getting the disease and has all the sort of full-blown manifestations. What hope is there for them after that, if the disease is kind of sort of hit full bloom and compromise their vision and so forth. And so I think specific targeted therapies for diseases which hit this kind of advanced phase, in which in many regards, frankly, the diseases look more similar than different. So advanced Norrie disease, advanced fever, even advanced stage 5 ROP, and advanced persistent fetal vasculature, they look more alike than different in many ways, in that the retina is often totally detached or nearly totally detached, and there's a lot of scarring. So fixing the retina for those children, and now we're talking generally outside of infancy and sort of juvenile age all the way through to adulthood, fixing the retinas at this juncture is really not something that is practical. Not that nothing can ever be done, but in general terms, fixing the retina is really not going to be the way to go. So now we're talking about alternative vision restorative therapies. And there is a lot of research going on in that direction, using different sensory pathways. There's research looking at cutaneous or skin pathway modulation to subserve a near vision-like function. There's research in the area of using taste or taste pathways also to serve vision. So research in those areas is already going on. So I don't think it's fair to say that they're entirely in their infancy. And I think that they have some really, really interesting results. But these lines of research are for surrogates of vision and not providing true vision. So we all hope, of course, that there'll be an alternative that's better than that for the future. We can restore vision. But at the moment, these alternative sensory pathways probably offer the greatest hope.
And I'll just add one other thought to that, which is one of the things that we really did learn from the retinal chip was that the dogma had been that if you didn't establish that pathway, that the visual cortex would not be capable of vision, basically, or interpreting vision. And one of the, I think, the most interesting findings from the retinal chip was that people who had never had sight actually were able to have visual images. So the visual cortex doesn't necessarily need to have a pathway directly to the eye from infancy in order to be stimulated. So that is one of the reasons I think also that these alternative pathways are exciting too, because there are different ways to kind of shortcut and stimulate the visual cortex.